which is a procedure to treat erectile dysfunction, or ED. ED is a condition that affects millions of men worldwide, and it can have both physical and mental detriments. So, for our patient, the background is he is Mr. Adams. He is 58 years old. He's been dealing with erectile dysfunction for a number of years and has tried several different treatment options, including medications like Viagra or Cialis. These medications work to increase blood flow to the erectile tissue of the penis, but they did not garner that much of a result. So he moved on to a vacuum suction device. This device basically creates suction around the penis to draw blood up, and then once the blood is in the erectile tissue, they put a constriction band around the base of the penis to keep the blood from flowing back down, and that will help maintain the erection. Because neither of these treatments worked, the doctors believe that he has little to no nerve function left in his penis, so they're moving on to the penile implant because that's the only other option past that. The purpose of the procedure is to basically restore his sexual function, and to also to basically just get the sexual function back up there when the other medications or treatments aren't working. Unlike the medication or the external devices, the implant provides a very reliable internal mechanism that produces an erection. It doesn't affect sexual desire or sensation, but it simply replaces the body's natural mechanism for getting to an erection. The goal basically is just to improve his confidence, mental health, and his relationship with intimacy. There are a few different types of penile implants. The two main types are inflatable and malleable. The 3-piece inflatable is the most complex or advanced. It has 2 cylinders which go into the erectile tissue of the penis, a pump which goes into the scrotum, and the pump is basically like a switch that inflates or deflates the cylinder, but basically fluid goes in, not like inflation, fluid goes in to inflate it. And then there's a reservoir in the lower abdomen where the fluid is stored when you don't want an erection. And then the 2-piece is a little more simpler. It doesn't have the reservoir, so the fluid just stays in the cylinders at all times, so it kind of keeps the penis rigid at all times. But it is a little more natural than the malleable, because malleable is 2 rods that are placed into the erectile tissue and basically just are at all times hard. It is very, it never gets soft. So to compare all 3 of them, the 3-piece is the most natural. It's the one that gives the most natural feel and experience, but it is a longer surgery, it's higher in cost, and because there are more pieces, there's a higher likelihood that you will have a mechanical failure. The 2-piece, it's kind of the middle ground between the 3-piece and the malleable. It's a little bit less complex of a surgery, but less natural than the 3-piece. The malleable, it's the most cost-effective, it's durable, but it is always partially firm, so it is hard to conceal. The type is chosen based on the patient's health, anatomy, and preference for convenience over natural function.
Yeah, so the procedure is pretty straightforward. It's a pretty simple procedure. Takes about 1 to 2 hours. It's usually inpatient, so actually you just go in, they administer anesthesia, they implant the cylinders in the corpora cavernosa, the reservoir in the stomach or the abdomen, lower abdomen, and then the pump is in the scrotum. So it's basically they just little incision and they insert everything, make sure everything works, and then sew you back up. Very quick. Surprisingly, they said up to maybe only 45 minutes to 2 hours. The 2-part system, basically, like June said, it's in the, instead of the reservoir is in the cylinder, like at the base of the cylinder, but functions the same way. Basically, you would press the pump on the scrotum, and the inflate. Sorry. Yeah, inflate, and then you would basically deflate it the same way with a release valve. All components are internal, so you would never know unless somebody told you, or either way. So yeah, it's pretty straightforward. You just need a surgeon, usually a urologist, specializing in this kind of thing. I did read that like the failure is a lot higher for people who aren't specialists. Well, because they said there's like low volume and high volume surgeons. And so like obviously you would want to go someone that's more specialized in this kind of procedure. The risks are pretty low. They're basically simply related to any kind of surgical procedure, like infections, bruising, bleeding, scarring, that kind of thing, and mechanical failure. But they said that these kinds of implants are very reliable and they last up to 20 years. One doctor I read compared it to like a car. You replace it every 10 years. It's pretty straightforward, that's what they said. It's not suitable for patients with active infections or certain medical conditions like if you have uncontrolled diabetes or heart disease. Recovery is also very straightforward. 4 to 6 weeks after, you can basically resume normal life and sexual activity. Temporary stuff, like I said, they usually send you home the same day. There's temporary swelling, bruising, discomfort, they usually treat with just normal painkillers. And then, so like I said, the success rate is really high. It's usually over 90% patient satisfaction rate. It doesn't affect anything. It basically functions normally as you would. It's the highest rated treatment for ED, higher than any other or pills or the constriction pump. So basically, if people get these, if they can pass the stigma of it, they prefer this to any other treatment option. So the inflatable ones are more complex, but much more natural. The malleable ones, very interesting. It's like there's basically only an up or down. And so I think that probably the inflatable ones are much more preferable. Questions?
Do you have to manually use the pump?
Yes,
a manual pump.
Yeah, it's like a switch.
You push it like a button?
No, it like swivels kind of. It's hard
like
to
inflating a balloon. Basically.
Yeah.
It's like a manual
It's like
pump, and so it's saline solution, I think, basically fluid, and so basically just fills the core. Yeah.
Point it out on those. Use your laser in the middle. So that's the fluid reservoir.
Yeah, that's the
Fluid
reservoir.
and then here's just a little pump. And so basically the pump would send the fluid into the shaft and basically inflate the penis. And basically you can maintain an erection for as long as you want it. You just basically deflate it.
How does it drain if you don't want it anymore?
You basically just reverse it with the pump.
Yeah, it just goes back to the
Release
reservoir.
valve, basically, and it goes back into
So
the
it's the same
reservoir.
It's-
liquid for however long you have it in?
Yeah.
Yeah. I think that's why it has a 20-year expiration
It's basically just mechanical.
What's that metally looking thing that you have the laser on? What's that?
Right there.
It's probably just the base for like.
Yeah, it's where the fluid goes in from the reservoir.
I think they attach this to the base of the shaft.
Okay.
Yeah.
Do they still have the ability to ejaculate?
Yeah.
Yeah.
It doesn't affect ejaculation or sensation at all. It is literally just for erection.
And so this goes just into the corpuscle cavernosum, like we learned today in lab. Basically, and that's just the chamber that fills with blood. And so basically, you're filling it with saline fluid to.
So, Go ahead, Austin.
I just had a question, like, do you guys know, like, how long does it take, like, for it to, like, erect, like, after clicking the switch?
I said it takes like a minute or two.
Yeah, I'd say a minute.
Is it possible to pop the reservoir?
I did not read anything about that.
This is all internal.
Or
so-
like accidentally inflating it, like what if like
This goes
You must be having a seat.
No, that was
You would actually have to pump it